everyone, my name is Amanda. I'm a registered nurse at Baptist. I work in surgery, and I wanted to bring you all here so we can talk a little bit about antibiotics. Okay? So we're having an issue with antibiotics these days. It's becoming harder and harder to treat bacterial infections because of the misuse. So there's a few objectives I want us to be able to understand by the end of this presentation. One would be, I would like for you to be able to verbally state 2 uses of antibiotics. It'd be nice if you could describe one way antibiotics become resistant. Also identify 2 ways to prevent overuse of antibiotics. So a little history, background about antibiotics. Where did it originate from? Well, it was a mere accident. Alexander Fleming, back in 1928, went on a vacation. He left his lab in a wreck, and in a petri dish he left some staph, which staph is basically found on your skin, and if you get a cut, it gets into that wound, it can cause infection. It can affect your body in a negative way. So he gets back from his vacation and he looks at the petri dish and he sees that there's little spots in the petri dish, and he tests those little spots and he finds out there's mold there. Well, he's like, staph hadn't grown in those little spots. Let me try putting it in with other bacteria. And so he did that, and he saw that the bacteria would not grow wherever the mold was. So that's how we came to penicillin. He multiplied the mold and made it into antibiotic, started using it on human beings, and it worked. He started treating people with mold, which is penicillin. And in surgery, we use penicillin a lot. That's like our main antibiotic for any procedure that we do. So some of the antibiotic uses are bacterial infections. Of course, we know that. I'm sure everyone in this room has had an antibiotic once in their life. Also, we use it for farming. A lot of farmers, about 80% of the antibiotics sold in the United States are sold to farmers to give to their livestock. And that's to prevent illnesses, and that's also to help with growth. And also we see antibiotics in our household cleaning products. So, too much of a good thing can be a bad thing. We know that. Doctors overprescribing antibiotics, for example. Say you go to the doctor, you're feeling sick, you don't know what you have, come to find out you've been tested for the flu. Well, recently I've been tested for the flu. It was positive. Not only did I get a slew of other medications, I got an antibiotic. Well, the flu is a virus. It's not a bacteria. So why was I prescribed antibiotics? And also colds. Colds are viruses. You can't kill viruses with an antibiotic because antibiotics are specifically for bacteria. So most times it's not a good idea to get an antibiotic for a flu or cold situation. Also, I mentioned earlier, farmers, they give, or 80% of the antibiotics sold in the United States are fed to the livestock. That's pretty extensive. And the problem, how we are affected by that is when we eat that meat, antibiotics get into our body. And so that's further causing issues for whenever we try to treat you with the antibiotic, your body's used to it. And so the antibiotic we give you doesn't work. So now that we know that we can't overuse antibiotics, let's talk about what happens when we do overuse antibiotics. They build a resistance. First off, antibiotics do kill bad bacteria, but they leave some of the bad bacteria behind. And that bad bacteria starts to get stronger. It mutates. And so when it mutates, it builds a resistance against the antibiotic. And then it shares that knowledge, so to speak, with other bad bacteria, and they get stronger too. Meanwhile, your good bacteria is dying off as well. So your body is just having trouble trying to fight off this bacterial infection, although you received an antibiotic. And so the bad bacteria takes over. that develops a problem or epidemic, the super bug threat. One of our super bug threats are MRSA, and basically we talked about that earlier. It's a staph, and it can be on your skin, and we talked about cuts, and if it gets into your cut, it causes infection. That is what MRSA is. It sickens 2 million people a year, and it kills 23,000 people a year. So it's an issue that we're trying to fight. And what are the drug makers doing? Hardly nothing. They're making their money off of antibiotics that we already have. They're spending less time thinking about making new antibiotics. And obviously they're spending less money. Meanwhile, we're having to fight harder and harder to fight off these bacterial infections with the old antibiotics that we have now. So what can we do? At-home solutions. Wash your hands. That's the first line of prevention. You see, you may not see that your hands are dirty, but there is bacteria everywhere you go. And anytime you touch something, more likely you picked up some bacteria. It's a good idea to wash your hands. But not only do you want to wash your hands, you want to avoid antibacterial soaps. Now ladies, I know we like our little fancy soaps from Bath and Body Works. I'm guilty. And they're antibacterial, and we think, oh, that's going to take care of it.
They love it.
But unfortunately, the more we use the antibacterial soap, we're still contributing to the issue of using too many antibiotics. And so that's promoting bacterial resistance. So it's best to just get your plain soap and water, wash your hands. Also, when you are prescribed an antibiotic, because they are needed, you may get one, make sure you use it right away. Don't prescribe your own amount of time to use it. He tells you, or he or she tells you to use it 7 days, twice a day. You need to be taking it twice a day for 7 days.
To do what?
Your antibiotics that you get from the doctor, you need to make sure that you're taking it as prescribed. Okay? And for instance, say if you get an antibiotic cream, use it sparingly. You have a little cut on your hand. Neosporins, you don't necessarily have to use Neosporin every time you get a cut. Go back to the old-fashioned way of cleaning a wound out. Soap and water. Okay? Also, be picky about the meats you eat. Now, this is harder in our society because these no antibiotic USDA organic foods are expensive. But as much as you can, try to purchase these type of meat products because, one, you're not getting all that, antibiotics that are being fed to the livestock. It's not being passed on to you. And then two, you're promoting companies that believe in the idea of let's not feed our livestock antibiotics. So, when you go to the doctors, you want to make sure that you're up on your vaccines because vaccines do prevent infection. Okay? You don't want to ask for antibiotics right off. Going back to the flu and cold situation. You don't know what you have for sure. So don't just automatically say, look, I need an antibiotic. That'll make me feel better. Not always. Okay? You need to let them investigate and decide, okay, this is viral, this is bacterial. We're going to treat it as such. Allow your body to fight it off. Sometimes we jump and go to the doctor. We might start coughing, sneezing, and then we're in the doctor's office. And you know what? Some doctors, we talked about it earlier, first thing they want to do is prescribe you an antibiotic. It's not a good thing because in the future, your body won't be able to use the antibiotic the way it should. And we talked about this too. Take antibiotics as they're prescribed. And when you do take antibiotics, and say you forgot to take some, you leave it in your cabinet for about 6 months, don't go back and take that antibiotic whenever you're sick thinking that that's going to cover you. Because it could be a matter of that the antibiotic no longer functions like it did when you first bought it, or it could be a matter of you're treating the wrong illness. You may actually have a flu, or have the flu, or have a cold, and you're giving yourself antibiotics, trying to pre-treat, trying to prevent, keep yourself from going to the doctor. So, say if you go into the hospital, God forbid any of us have to go to the hospital, but if you do, be proactive. You want to be sure that they're screening you for MRSA. Like I said earlier, it's prevalent in the hospital. It's everywhere. So important to wash your hands when you go to visit a loved one, or if you're in the hospital. Try to, use as much alcohol rub. Alcohol rub is okay. It's not in a bag. And so, also be proactive in your health care when it comes to shaving. If you are supposed to shave, ask them, do I have to shave? You don't want to shave because that goes back to you run the risk of the doctor. If you're having a procedure done and you don't want them to shave, you can tell them, no, I don't want you to shave me, because you have that right. And the reason that you want to forego that option of being shaved is because you could get a nick, and that MRSA we talked about earlier could get into that cut and cause infection. Also, cleaning. You want to make sure that the people that are taking care of you are cleaning their hands. And we have this issue at my job. We do this foam in, foam out. And when we walk into a patient's room, we have to get some alcohol wipe or alcohol foam and say we're foaming in. And then we leave the patient's room, we're foaming out, because we don't want to we don't want to spread bacteria from one patient to the next patient. You got a question, sir?
You have to do it anytime you walk in.
Yes, sir. Even if I came in to visit you once, I left out and I came back in, I need to foam in and foam out. Because I can touch anything. I can touch another patient's chart, I can touch a rail and pick up bacteria and then come in your room and give it all to you. Okay? And if I do, then if you get sick, we got to give you antibiotics. And there we go again, using too many antibiotics when we didn't have to. So that's in the hospital. Also, some other things to think about. If you do have to stay in the hospital for more than one day, have some bleach wipes with you. Just like when you go to stay in a hotel, you want to wipe everything down, a remote, clean up the bathroom a little bit. You want to do the same thing in your hospital room, because we have housekeeping, but they're human. They miss spots. And the hospital is a collection of bacteria. So many people have been in that room, and there could have been one little spot that was missed, and overnight that bacteria could grow and spread. So it's a good idea to wipe down your bed rails, your doorknobs, your TV remotes, things that you're going to be touching a whole lot.
Yeah.
And also, another part of being proactive about your health care is to ask questions. And I notated catheters and drains because a lot of patients don't think about this. You have the right to know how long that catheter is supposed to be in. And when you know how long it's supposed to be in, you have the right to ask your nurse, hey, this is supposed to come out. This catheter is supposed to be removed today. When are you going to do that? Because your nurse is human too. She may have gotten busy with someone down the hall and forgot that your catheter needs to come out. And the reason it's so important to get those out, that's a way for bacteria to get into your body. Okay? So that completes the presentation today. I really hope that you got something from this and understand how important it is to be proactive when it comes to preventing the spread of bacteria. And that will also assist in us not overusing antibiotics. Okay? So thank you so much for coming out to listen to me.
Thank you.
Well,